ultimately, who should be treating this as board-certified plastic surgeons. We handle the liposuction, we handle the skin excision, we address any of those potential downstream complications. We know how to treat them. And so we're really the ones that should be doing this operation. Why I treat it is because I really love the patients. They're extremely motivated, they're very dedicated to getting better. It's such a great feeling to see all of these positive steps that happen with every stage. Like after that first stage of lipedema surgery, you can walk around easier, you can start feeling your knees that you haven't been able to feel in decades. And it's such a good feeling to really see all of those positive changes that happen from the treatment that you provide. Thankfully, today lipedema is widely covered by insurance companies. No one should really have to pay tens of thousands of dollars upfront in order to get treatment for lipedema. The way that we do that is by getting an out-of-network exception and then a one-time single case agreement with your insurance company to cover all of the stages of your care. And a big benefit of this for patients is you're not penalized for going to an out-of-network surgeon. That's one thing we negotiate during the single case agreement, is that your co-pays and deductibles are as an in-network surgeon, so you're not paying any additional fees. One of the big advantages of going through insurance is it really takes a lot of the financial decision-making out of the equation. We can really focus on what is the best treatment strategy for the patients. What stages do we need to accomplish and get to that finish line? Ultimately, lipedema is a disease that is multifactorial. So there's a genetic component, there's an environmental component. The first time a patient sees me, I know my role in the treatment algorithm. They've already tried a lot of different devices, supplements, diet and exercise. By the time they see me, really the discussion is controlling the disease, and we do that by surgery. Okay, so it involves liposuction, and then it involves skin excisions too. This is really just as important of a component as the liposuction. I've seen so many patients that have, small little, they could even have 5 or 6 surgeries, small little liposuction cases, but they didn't address the skin. And by the time they see me, their lipedema has worsened to the point where it's almost like they didn't have surgery at all. So efficiently progressing through the stages is also an important component of the surgical treatment of lipedema. We want to progress through the debulking phase and the skin excision phase so you get to a real baseline where your skin is now tight, you can put compression garments over, and then that will keep that lipedema at bay. Typically, that first stage is where we really want to make a lot of progress in terms of debulking the lipedema. And so oftentimes that is a liposuction-only operation where I'm really working to remove as much fat as possible from the thighs, the knees, the calves, the ankles, sometimes up into the hips. And that really puts us in a good position to see how your body is going to react. And so oftentimes I don't actually do the skin excision at that first stage. We go up to the arms, for example, for the following stage after a few months. And then by the time we go back down to the legs, a few months after that, you're looking at, between 6 to 8 months of healing time. So the swelling is down, the skin has snapped back as much as it will, and we have a nice solid target for addressing additional liposuction and then ultimately taking the skin excision. So it's more common to do the legs in a staged approach. Even for a stage 2 or a stage 3 patient, oftentimes we want to have that initial surgery for that initial debulking, and then we can really fine-tune in later stages. Do I do 360 liposuction? It's often a question I get asked, and so I'd like to talk a little bit about that. Ultimately, this question boils down to the surgical plan and individualized treatment plans for patients. Not every patient is a stage 1 or 2 or 3 or 4, so you can't really treat them all the same. So in terms of what I perform for any given stage, a lot of it has to do with what we're trying to accomplish for that given stage. Stage 1, where we're really trying to debulk as much as possible in the lower legs, oftentimes I do 360 lipo, especially in the calves. I can lift your leg up and do all the way around your calves. When I'm up in the thighs, I'm typically addressing a lot of the medial thigh, anterior thigh, lateral thigh, and oftentimes going down, lifting the leg up, and even getting the posterior thigh in patients where that's a problem. Ultimately, we want to treat every patient as an individual. So if something needs 360, I'll do 360. The way to think of the skin excision portion is really reestablishing the natural compression of your leg. We're going to wear compression garments after the operation, of course, but that's just an additional barrier. Really what we need to do is we need to debulk the leg, get rid of that diseased lipedema tissue, but then we need to reestablish the normal tensile strength of your skin so that the leg doesn't fill up with lipedema tissue again. And so it's usually a component of the lipedema treatment. In maybe a stage 1 patient, or if they're very young, we're not going to do skin excisions if they're not necessary. But for those patients where they're necessary, it's an important component so that we don't get reaccumulation of the lipedema. One question I often get is, can you do the liposuction and the skin excision of the arms at the same time? And so that's actually quite a common occurrence in my practice, but not for everybody. You have to remember that a stage 1 or stage 2 lipedema patient is very different from a stage 3 or 4. So it really all has to do with the amount of fat in the arms, whether that can be taken effectively and the skin removal done at the same time. Ultimately, whether we do a single stage or a 2-stage approach to the arms is really dependent on you. How long will it take to complete my treatment? How long is this journey? Almost everybody asks me this question. And so the answer is a little bit nuanced depending on your stage, depending on how many stages that we're going to perform in your care, that number is going to be a little bit different. Typically, I like to leave about 3 or 4 months in between each stage so that we allow your body to recover before proceeding to the next stage. So you can imagine if we do a 3-stage surgery, then that's going to take around 9 months to a year to complete. And obviously there's going to be, slight differences in that, but that's generally the answer is 3 to 4 months in between each. I can perform the operations in a surgery center, I can perform the operations in a hospital. There are a number of factors that come into play when we ultimately decide that, and it's really a mutual decision that we determine together. Some patients are out of town, some patients are higher stages, and that may warrant an in-hospital, high-volume liposuction case. If I take more than 5 liters, I'm going to do it in a hospital. You'll stay overnight, I'll discharge you the next day, and that's a way of efficiently moving forward through the surgeries. If you're a local patient and you prefer an awake liposuction case or just a smaller case in a surgery center where we take 5 liters, that's also completely, okay, and that's something we determine in your consultation. Anesthesia options are very important in terms of the patient, and they ultimately do affect the surgical plan, so I'd like to talk about that a bit. Ultimately, patients can decide whether they pursue an awake liposuction case or a smaller conscious sedation case in a surgery center or a general anesthesia case either in a surgery center or a hospital. Ultimately, in an awake lipo case, you're not going to be able to take the same amount of fat as you would in a general case in a hospital, obviously. And so that does play a role in the ultimate plan. If the patient is in a higher stage, a stage 3 or 4 lipedema patient, we might, go the route of high volume in a hospital. If a patient is a stage 1 or 2 and they would prefer to do it in a surgery center and they don't want to be put to sleep, that's certainly something that we can do as well. Ultimately, this is a joint decision, and so part of the consultation process is us deciding together. So with lipedema surgery, these are often large operations, and it's very important for us to do everything we can preoperatively to set you up for success. So there are some big topics that I'd like to talk about. One of them being nutrition. It's really important before your surgery, weeks before your surgery, even a month before. You really focus on good nutrition, high protein, fruits and vegetables, making sure that we get rid of any medications that could lead to problems like blood thinners, steroids, things that could lead to wound healing problems. Get those out of your system beforehand. Taking labs beforehand and addressing those abnormal lab results if need be. Sometimes patients have asymptomatic urinary tract infections. Sometimes their blood count isn't where it needs to be, and so we address that before the surgery. Compression garments are another really important topic. I really encourage my patients to start wearing their compression garments every day before the surgery so they get used to it and it's not such a big change, after the surgery. Antimicrobial washing right before the surgery. A couple times before the surgery, days before, I have you use an antimicrobial wash to take care of a lot of the bacterial burden. From start to finish, from the pre-op phase to intra-op, post-op, we're doing everything we can, really lining up all of our dominoes to set you up for success. So I see a lot of out-of-town patients as part of my practice. Ultimately, we want to make that as seamless and easy of a process as possible. Lipedema surgery often involves 3, sometimes even 4 stages. Not always, but because of that, we want to make this process relatively easy for especially our out-of-town patients. So we rely on telemedicine a lot of times for our initial consultations and back and forth as far as integrating your primary care physician to do some of the pre-op clearances, doing your pre-op labs ahead of time so that we have a number of weeks to address whatever abnormalities may be showing up. So if there's an asymptomatic UTI, we can have you treated so it doesn't result in delaying your care. Ultimately, we try and keep the patients here for about a week after the operation so that I can see you before you either fly or drive home. And usually that's absolutely fine, and we're able to do that. Patients that may not have family that's going to be traveling with them, we do partner with aftercare nurses and facilities that really make that process easy for just that additional help for those first couple days after surgery. Ultimately, the whole idea is just to make this as easy of a process as possible for you. Let's talk a little bit about recovery. When you wake up from the operation, most people are pretty well numb because of the tumescent solution I put in their legs. That tends to wear off after maybe 12 to 24 hours, and that's when we start relying more on our oral medications, and we tailor those so that you're not in an undue amount of pain. Typically, 1 to 2 weeks is right around the time when you start feeling back to normal. We want to let your body heal, we want you to rest, we want you to maintain good nutrition, because that's going to get us over that finish line without any undue complications. Another important consideration: when can you exercise? I like to give maybe 4 to 6 weeks before any strenuous activity, so like working out, running, things like that. We want to allow your body to heal. But in terms of walking and moving around, I basically want you up and walking right after your operation. Keeping close tabs on your oral antibiotics and your pain medications, not missing anything so we're not playing catch up in terms of your pain control, and ultimately just making sure that we're doing all the things post-operatively to set us up for success so we minimize any complications and we have good results. How do I maintain my results? So extremely important, once we get you back to your baseline where you're feeling good, you're looking good, all that extra fat and skin are gone, we want to make sure that we maintain those results. And so one of the biggest factors in that is wearing your compression garments. I really encourage my patients to order a number of different garments. Every one is going to fit you a little bit different, and so pick a compression garment that it gives you adequate compression, obviously, but also is comfortable to wear. So you can wear it underneath your clothes. Obviously, if you're going out on a date and want to wear a dress, obviously okay. But when you get back from your date, put your compression garments back on. That's going to allow you to maintain your results over time.